Grant Robertson.
Thank you very much. My question is to the Minister of Health. How much did Vote Health need to increase in Budget 2011-12 over Budget 2010-11 to meet the best estimate he received for growth and costs being faced by district health boards?
The Honourable Tony Ryall.
Mr Speaker, I'm advised by the Ministry that their estimate for the demographic and population growth calculation...
Point of order, Grant Robertson.
Sorry, I couldn't hear
I fully understand that. Could I ask, I must say, are members finding the volume on the sound system low today? I think the reaction from members has been quite, it was too loud yesterday and it's now too low today, because I couldn't hear the Minister's answer either. And all I'd urge is, until we get the sound adjusted correctly, if ministers could just speak into the microphone a little. The Honourable Tony Ryall.
Mr Speaker, I'm advised by the Ministry that their estimate for the demographic and population growth calculation for district health boards for 2011-12 was $459 million. For the total Vote Health, it was estimated to be $576 million, and $585 million was made available in the budget.
Grant Robertson.
Question, Mr Speaker. Can he confirm that of that $585 million, $165 million in fact comes from cuts in other parts of the health budget?
The Honourable Tony Ryall.
Mr Speaker, I would refer the member to the press statement that the government put out at the time, that $165 million has come from reprioritisation and the use of unallocated and unspent money.
Grant Robertson.
What reasons can he then have to disagree with Councillor Trade Unionist economist Bill Rosenberg that funding for the health sector fell $127 million short of what is needed to keep up with growth in health costs in the budget overall, and $108 million short for district health boards?
Order. Before I call the Minister, I must say, despite the member sitting only 6 feet from me or a bit more, I struggled to hear the question. Did the Minister hear the question? The Minister believes he heard the question, so the Honourable Tony Ryall.
Mr Speaker, my response to Dr Rosenberg would be that he said the health service needed something like $570 million to match demographic and population growth, and the budget makes $585 million available.
Supplementary.
Dr Paul Hutchison.
Thank you, Mr Speaker. To the Minister of Health. How much new additional resource has the government added to Vote Health over the course of its 3 budgets from 2009 to 2011?
The Honourable Tony Ryall.
Mr Speaker, I can inform the House that despite the world's most serious economic recession in 80 years and the additional costs of the Christchurch earthquake, this government has been determined to protect and grow the public health service. In these times when many other countries have been forced to reduce health staff and budgets, this government has invested a huge extra $1.5 billion of new money into health over those years. This has helped pay for frontline services such as the extra 500 doctors and 1,000 extra nurses now working in our district health boards.
Grant Robertson.
Further to his answer to my earlier supplementary question, can he confirm that his media release on the day of the budget indicated that there was $420 million worth of new spending rather than the $575 million his own ministry advised was needed to keep up with cost growth?
The Honourable Tony Ryall.
Mr Speaker, what I confirmed was quite clearly that the government's made available $585 million for the health budget. This has been an extraordinary part of the $1.5 billion extra of new money that's gone into health over 3 years. It is simply unmatched.
Speaker. Supplementary question, the Honourable Trevor Mallard.
Was the Minister counting the $165 million of recycled money as new money?
The Honourable Tony Ryall.
Mr Speaker, no.
Grant Robertson. Supplementary question.
Can the Minister confirm that his press release on the day of the budget indicated that $165 million of the $585 million he is claiming was recycled money from other savings in the health sector?
The Honourable Tony Ryall.
Mr Speaker, the health budget press release made it absolutely clear that there was a contribution to the funding of this year's available budget coming from reprioritisation and the use of underspends and unallocated money. That's the reason why we have been able to put $1.5 billion of new money into health over 3 years, plus reprioritising low-value spending.
The Honourable Trevor Mallard.
In light of his latest answer, does he want to correct his original answer, which indicated that there was 580 odd million of extra money?
The Honourable Tony Ryall.
Mr Speaker, the question was, member needs to check the question that he asked. $585 million is made available for Vote Health in this year's budget.
Point of order, Grant Robertson.
Mr Speaker, I seek leave of the House to table the Council of Trade Unions working paper on health that shows that the budget was an estimated $127 million short of allowing a standstill in health expenditure.
Leave is sought to table that document. Is there any objection? Well, there is objection. Question number 6, Chester Borrows.
Mr Speaker, my question is...